superintendent and people discussing it with the telecom. So it looks like they're covering it from all the angles. 9:05. We talked about daycares earlier, Bree.
Yes, we did.
And I want to bring on Tess Archangel and Elsa Perez from the Department of Public Health and Social Services to discuss the guidance. Good morning, ladies.
Good morning.
Is this guidance coming from Public Health and CDC regarding daycares, correct?
Yes.
Okay. Could you guys speak up?
Okay.
Okay.
Can you hear me okay?
I can hear you. Tess.
Yeah.
Tess,
Yes,
give me
I
a
can
1
hear
2 1 2.
Okay, I can hear you clear.
Okay.
Okay. Okay.
All right. Can we hear each other?
I can hear you clearly.
Okay. Who is your favorite male on the radio on I-94 right now?
Chris Barnett. Chris Barnett.
Okay. Just checking. The line is clear, Bree. The line is clear.
I'm glad we established that.
Right. So just tell us what are the guidance? What guidances? Is that the word? Do we have for daycares upon reopening, ladies?
Okay. If you're talking about specific guidelines with regards to reopening, DPHSS is still coming up with the guidelines. It has to be in conformance with the federal guidelines also. So though we have CDC guidelines, that needs to be specific for child care. So we're still coming up with that.
Have you received the guidance that I think the Giving Tree and the child care organizations have submitted? Have you had a chance to review that? Because I believe they were mentioning earlier that they were written with CDC guidelines and other federal guidelines taken into consideration.
I have not read the one from the Giving Tree.
Mm-hmm.
I have read another one from another provider with their tentative plans on what they plan to do when they reopen to be to have their facility in place to protect the children, to protect the parents and employees.
Right. And ma'am, does it work that the individual businesses give it to their chamber reps, and then the chamber reps bring it to the recovery council, and then it goes to you guys? Is that how it works?
It's kind of different because, for example, like the cosmetology, they have a board. With childcare, there isn't a board. When a daycare is to open, they have to go through the licensing requirements, which entails getting inspected by Division of Environmental Health, Public Works. They have a whole slew of agencies that have to ensure that they're in compliance. And there's, local regulations in statute on what they need to comply with. But with COVID, it's totally different. It's a totally, in fact, I was just sharing with Tess, we did have a conference call, and some of the states were actually sharing that although CDC has all these things in place, it's not that specific to child care, and there aren't really straight regulations that the federal government has put into place specifically for child care for reopening. And I'm pretty sure it's because it's kind of very too soon, or this thing is happening so rapidly that it's really kind of hard for the industry to just I guess really formulate real guidance that's really safe to reopen. I heard from one of the providers, and it actually came from a provider, that in Texas a facility opened, a child care center opened, and 60 people were, contracted, and they developed COVID, so they had to shut down. So when we reopen, we really need to be very careful because, this disease is very, I don't know.
It's very contagious.
Yeah,
right?
very contagious, and it's going to affect so many people, the children especially, the providers themselves, and the parents, so.
And at the same time, because we're dealing with children, we really have to monitor them closely, unlike the adults.
Yeah.
So
Yeah.
we really need to be very careful in developing guidelines, a plan for the daycares. It's totally different.
Right. So let me, because it kind of sounds like you guys are saying, oh, no, hold on a second. So the guidelines that we have in place, although they don't specifically, like you said, deal with childcare, what type of guidance would you guys give to maybe strengthen those guidelines that we have? And are you also confident that the daycare centers, like the businesses, can come up with their own ideas, and then you guys vet it and say, no, that's not going to work, or oh, we like this, or whatever?
No, definitely it's not like that. We need to assess all angles. We need to assess all guidelines, all plans that they're going to submit to us, and come up with the best solution. 10 heads is better than one. I cannot come up on my own. These are childcare centers. Basically, they deal with children, and they know how these children act. They know how these children interact, and if they can show how they're going to prevent that, the physical distancing, the sanitizing, the monitoring, then definitely we have to put that all together into consideration and show it to them, show it to the department's director and to the governor for them to be ready to open.
So is there a sense of urgency or anything, ladies? Are we trying to maybe proactively reach out to these providers? Because, as you know, the governor is reopening the island, and that means people got to go back to work. But if there's nobody to watch the kids, ay nako, what are we going to do?
That's true. As we said, we're coming up, the Department of Public Health is coming up with a guideline. And at the same time, there's really no concrete guidance from the Fed on the federal level. So we're trying to communicate with the ACF with regards to that. We cannot just say, yes, this is a good plan. Who are we to say this is a good plan?
Your public health.
So
Yeah,
these guidelines
that's why-
weren't being
why we're-
considered the same time the decision was made to open into PCOR 2. Did nobody realize that we were going to need childcare when we start reopening the island and businesses?
Yeah, we do consider that, but at the same time, as I stated earlier, there's no concrete guideline
Right, yeah.
for childcare.
Mm-hmm.
So
And
what's
so we are very cautious because we don't
Right.
want, yes, go ahead, we have a plan, open them, and then something happened, there's a surge, that like what Elsa stated, what happened in Texas,
Right.
people,
So, but has there been any verbal communications with these childcare facilities? Because I want to say that what's her name, Melanie,
Lonnie, yeah.
or Lonnie. There is a group. I don't remember what the name of the group
it's
was.
like a child care council.
Child Care Association.
Thank you.
Right. So, has there been any verbal communication with this childcare association?
We do have a licensing office.
Mm-hmm.
Licensing officer has been really communicating with a lot of the providers.
Mm-hmm.
What the providers want to hear from us is, okay, you can open, but we are not in place to say that they can reopen.
Right.
There has been a lot of communication, and I hear them, and I understand that, but I guess the answer that they want to hear as to when can they reopen or open, that answer, it's just, we're not ready to give that yet.
Mm-hmm.
Well, Tess, you can go ahead.
It kind of sounds like you guys are flying blind here if there's no real
Guidance?
from the federal government, and you're saying that you're not the entity to make that final determination. What are we going to do then?
as we stated earlier, the Department of Public Health is coming up with the guidelines, and that guidelines will be reviewed. And at the same time, definitely, we have to ask the federal guidelines. We'll have, I mean, the federal people, will have them review that guidelines too.
So are we talking weeks, a month, or any idea?
You know, Elsa can attest to this. When we're dealing with federal people, it takes time. That's honest. That's my honest answer.
Well, thank you for being honest, Tess.
Elsa can attest to that.
Right.
We have been asking guidelines from them. It's because they're dealing with a lot of states too.
Right.
And call after call, conference call after conference call, even if you email them, the response takes a while. And we cannot blame them.
Something else Lonnie mentioned was that these child care facilities, people aren't even allowed to go inside to like clean or disinfect. And is that true?
No, they can. They can do administrative work. Yes, they can. In preparation for opening, for opening either in Core 3 or Core 4, they can.
In
as
Core
long as they
3.
practice, of course, if they're going to have some staff there who assist them on cleaning, as long as they practice physical distancing and
But
sanitizing, they can.
but
They can
only
do
in P Core
administrative
3,
work.
you said.
That
Only in P
was-
Core
yeah,
3,
that-
not
that was-
now.
That was the directive that we had received, that, you know, they couldn't go in. Now, however, there has been guidance that say that they can now go in to do essential work such as administrative, but the initial instruction was that, you know, to be safe, those things couldn't be done.
And that was just kind of to minimize the risk and the spread, right? Potentially.
Right.
So, administrative, does that mean cleaning? Can they go in and like clean their places or what? Okay.
Yes, in preparation, yes.
Yeah, but, you know, again, I just want to make sure, because that was the guidance that initially we have received, that those functions were not to be done.
Right. And so when did that guidance change? Because the daycares, at least the couple that we spoke to, are still under the old guidance.
Yeah.
Des, go ahead.
We just had a conference call with our DEH chief, and he stated that, yes, they are allowed to do administrative work, essential administrative work.
When was this, Tess? Just yesterday?
Today.
Today. Okay. So it changed today. Oh, because you're saying like, oh yeah, it's been changed. They can go in with change right now. That's why they don't know. Okay.
Surprise.
Yeah. Hey, surprise, guys! Go clean your area. Now, Gus Guam.
So this is what, Tom Nadeau?
Yes. But I guess because we asked him, I guess Heidi, I'm not sure when Heidi last communicated with them, but then again, because that's the height during those times, if that was mentioned, that was the instruction provided before, is to prevent, of course, because there's not much guidelines on what they have to do during, that was in March. So it's very fluid. You know, at this time, we're allowed to go out, but as long as we have masks and there is physical distancing, yeah.
All right. So
wow, I don't really know if we have any more clear. Are we any more clear? So we don't have any guidelines. You guys are developing the guidelines.
but there's not necessarily any federal guidelines for you to follow as you craft the local
For
guidelines.
child care, no,
Mhm.
there's no specific guidelines for child care.
So when you guys come up with your guidelines, Tess and Elsa, you have them. Are you gonna send it over to the feds to be like, hey, is this okay, or?
Definitely, we still have to get guidance from them, and whatever the daycare's plans are, we are going to review them and see what's best for everybody.
When you say federal, who are we talking about?
ACF,
And that,
Healthcare.
I'm sorry?
It's ACF and the
Administration,
childcare.
Healthcare and Family.
Okay.
Okay. Not adult correctional facility.
No, no.
No.
Administration for children and families.
Children and
Oh, I got it. Right. Okay, so, man, I don't feel like I want to hang up so you guys could work on those guidelines so that we could get some daycare out here.
Now I wanted to follow up with Tess.
Yeah.
How is you're in charge of the SNAP and the other public assistance programs, right, Tess?
Yes.
Are you also administering the Programmen Salapi Zuden Itatau?
I would not say we're administrating that. We
or
co-partner
you-
with Department of Administration.
Right, you accept the applications.
Yes.
Right.
We do accept the applications. We verify if they're under our program, and so we determine if there's some duplications on those. But ultimately, Department of Administration do the review of those applications and do the check right.
Okay. Have you seen a lot of people applying online?
Oh yes, a lot. I mean, I think for 15th, it's supposed to be the last day, we received more than 2,000 applications just for one day.
Mm-hmm.
Yeah, on May 15.
Wow.
Yep, just on that. Currently, I think what we've been reviewing up to the 13th, we have 3,000 applications. That's application. So we need to assess each member on it. I mean, household members, we also assess and check the duplications of those applications. We do found some.
Oh, you found some duplicates. How many people are currently in the program?
Under SNAP.
Right.
What do you mean?
Aside from the new applicants
The-
that are eligible for the
For-
Programmen.
For Programmen Salapi, as I said, it's Department of Administration.
No. But do you have an estimate on how many are currently in the program?
Well, I could only speak for the SNAP
Yeah.
clients.
Uh-huh.
With the SNAP clients, we did send, if I'm not mistaken, 12,000 applications. 12,000 recipients of SNAP were sent to DOA for check right.
Wow. And that's not okay. And that's not including the.
That's only for the Salapi program, right?
Yeah, and that's not including those who's not under our program.
So how
Yeah, the
many
new
total
applicants.
SNAP recipients are there on Island? And then Tess, so can you give us the total, and then also from the start of the public health emergency, do you have that data?
I do have the date. I have that data, but unfortunately my computer is asleep, so I have to.
Ay, nako.
You can wait.
But Tess, I'm looking at the numbers. We average about 14,000 cases for SNAP. I'm just talking about SNAP
14,000 per.
per month.
Per month.
It spiked in April, but then it went back down to the 14. We average about 14,000 cases or households.
Kind of, yes.
And that was sent over to the Department of Administration for the Programmen Salapi program, right?
Yes.
And that's not including the new.
Applicant.
Right.
Just
Okay.
for cash assistance, no, it's
Right.
not including that.
Yeah.
Fluffy.
But if they qualify though for the Programmen program, then they would qualify for the SNAP, right?
Yep.
Not necessarily, because we're pretty.
Depending on the
Funding.
But
Oh,
citizenship and things like that, so it's not automatic that they qualify.
yeah,
You said the what? Citizenship?
they have to be a U.S. citizen
Oh, I see. Okay.
or permanent legal alien.
For the CARES Act,
But not for Programma Salapi.
Not for Programma Salapi. For Programma Salapi, you can be a non-U.S. citizen and you can qualify.
I see. Okay.
Okay. Well, anything else you want to add, ladies?
No.
You're done?
You know, just with regards to one of the news where it stated that we're not paying the childcare providers. We do. The CCDF childcare providers, we pay them based on their enrollment. We in fact paid in April and March, and we're preparing for May.
Even
For the childcare providers, CCDF childcare providers.
and this is even despite them not having any children to watch.
Yes, we base it on the enrollment. It's not based on the actual attendance of the children.
Right. Okay. Well, that's good to know.
And this is the 14 was it the 6.4 million in CARES Act funding? Is that what you guys are using to pay out the community? Is it community development block grant?
Correct.
Yes.
Okay.
Okay, so yeah, it's kind of interesting because I think they were talking about how they weren't receiving anything.
So everybody's been paid.
Yes.
Okay.
Okay.
No follow up. Yeah.
Okay.
All right. Thank you.
Tess, thank you, Tess. Thank you, Elsa.
Also. Okay.
Let's make it a habit. Call back often, okay?
All right.
Okay.
Okay. I'll see you.
Be safe.
Wash your hands.
All right.
Okay. Bye.
Bye-bye.
9:27. Always a pleasure. The ladies from Public Health.
Yeah.
We got to take a little break, Bree, and then we're coming back. You might talk gyms as we've the conversation has been about daycares. Wow, I don't know what to make of that. It
I'm
sounds like
confused, right? So Lonnie's saying they weren't getting paid?
I don't know if she
Or
gets the block grants or other daycares
get
do,
the-
but there were daycares. I mean, maybe
But
they don't know they got to
Public Health has
fill
been
out the
paying
paperwork.
out.
I don't know.
Yeah. But they're working on the guidelines.
They said that there weren't really federal guidelines, so they're coming up with them.
Their own guidelines,
Their own-
and then child care facilities can submit their own guidelines.
Right. Yeah, that's what they said. And they've already reviewed a couple of those,
Yeah.
right?
I
So
think she said one.
yeah. So wow, good luck with that. I'm not really even sure what that means as far as the timeline. Seems like it's not going to happen this week.
Maybe they should just all have like a Zoom conference and
Oh,
just
yeah.
talk, with Public Health, hosting it, and people can just ask their questions on what needs to be done, I guess, and what needs to be in these finalized guidelines. So, yeah, that was quite interesting. And a little bit confusing, because I know I was reading on the Congressman Michelson Nicholas's Facebook page and how he was saying that this 6.4 million in community child care development block grant funding has been sitting with the government of Guam since April 14th. And
I mean,
you
that's
just
what he
heard from
said,
Public Health
yeah.
that they've actually been using that money. They paid for March, they paid for April, and they're getting ready to pay out May to these child care facilities. But it's based on enrollment, not
Right.
on how many children actually are.
Showing up, which is zero, because no kids are showing up.
Yeah.
I mean, I guess the only way to find out is to ask. I mean, that it was frustrating. Lonnie, the daycares did seem frustrated that they knew we got this 6.4 million, but it looks like it went to Public Health.
Yeah. Well,
Right.
yeah, I guess because they're the ones.
So
who
maybe
administer
asking
it.
Adelup wasn't the right call, and Adelup was like, "Oh."
But hey, the new development is that you can actually go in and start doing essential administrative work, which includes disinfecting and cleaning your daycares.
Well, there you go. 9:30 again. We'll take a break and come back with more.